Good afternoon. Thank you for listening to this recorded webinar. Today we are presenting a new program that was launched on May 1st called Safe at Work in Greater Dubuque. This program provides COVID-19 guidance related to safety in the workplace based on information and guidance provided by the Centers for Disease Control and the Iowa Department of Public Health. My name is Kristen Dietzel, and I'm Vice President of Workforce Solutions at Greater Dubuque Development. And presenting this information with me today, I have Mike O'Donnell from CIRAS at Iowa State University and Wendy Mim-Harold from Northeast Iowa Community College. Wendy, would you introduce yourself?
Good afternoon. I'm Wendy Mim-Harold, as Kristen has stated, and I'm the Vice President at the Northeast Iowa Community College, and I'm in charge of our business and community outreach. And we have been instrumental in partnering with CIRAS and the Greater Dubuque Development and ECIA in regards to our business helpline, and I'll be talking about that in a little bit.
And my name is Mike O'Donnell. I'm the director of our Manufacturing Extension Partnership Program at CIRAS, the Center for Industrial Research and Service at Iowa State University. We are helping businesses of all shapes and sizes understand how to respond to and recover from impacts for COVID-19.
Okay, thank you for both being here with me. Safe at Work is a partnership of the Northeast Iowa Community College Business Helpline and CIRAS. So we are going to be presenting the information that's available to you through this resource, which you can locate at greaterdubuque.org/safe. Again, it's greaterdubuque.org/safe. So Safe at Work, as I said, is a collaboration to assist our area employers in implementing COVID-19 guidance related to safety in the workplace and safety for your workforce. This is a response to employers contacting each of our organizations, asking for information on how to best navigate the information that is coming out from the CDC and the Iowa Department of Public Health, and that is changing very quickly. Safe at Work is a resource for those catch-all employers who do not have specific guidance already issued for their sector. So for organizations that work in long-term care, healthcare, food establishments, or schools or community facilities, you would refer to guidance that's been specifically issued by the Iowa Department of Public Health for those sectors. However, Safe at Work does apply to employers who are deemed critical infrastructure employers, so what we often refer to as essential employees, as well as employers who may be reopening after either a brief or an extended closure, either because of a positive COVID test or because of a state order. I want to be clear that Safe at Work does not issue any new guidance, nor recommend a specific employer plan. It is not legal or medical advice. Instead, what we hope to provide employers is a framework through which to think about these safety issues and a support process utilizing the COVID-19 business helpline for our region. So the first thing I want to share is this employer framework. As employers are looking at various pages, documents, PDFs, and links on what to do to maintain workplace safety, it's easy to get overwhelmed and not be able to decide where to start. We believe this framework provides a lens through which employers can think about the various pieces of guidance and a way to, a suggested resource for each of these questions. So we've organized this document into 4 questions for employers to ask. 1, how do I organize my workforce to create the safest possible environment? This is really thinking about the people, the work they do, and the positions they hold within your business. 2, how do I organize my workspace to create the safest possible environment? 3, how do I monitor my workspace to make sure it stays safe for employees? And finally, what will I need to do if there is a positive case or an outbreak in my workplace? So that first question on how do I organize my workforce, this is really a workforce assessment and risk mitigation step. The first thing employers want to ask themselves is how many people can I remove from risk? So this is where you will look at your employees, their positions, and determine if there are flexible working arrangements available for them to work remotely. If there are certain job functions within a company that can be remote, even if others have to remain on site. Can you move meetings to a virtual format or eliminate them? Can you create travel policies to restrict travel to unsafe areas? It would be a best practice for employers to identify a workplace coordinator to handle these kind of questions and to be the point person for education and communication back to employees who will need ongoing information, education, and support. Finally, even if your business has been identified by the Department of Homeland Security as an essential critical workforce, this guidance still applies. Employers who are essential are still urged to implement remote work where possible for specific positions, departments, or functions. The other question for employers to ask is what kind of options they have to provide to at-risk employees. This would be an opportunity to review leave policies, understand how you would implement federal policies such as the Families First Coronavirus Response Act, and then modify any existing policies as necessary to support possible extended sick or home quarantine periods. Companies may consider paid leave for these periods to encourage appropriate use. Finally, it's important to be aware of employees who might be at risk for COVID-19, such as older employees or those with chronic medical conditions. And employers can think about how they can minimize face-to-face contact specifically for these employees or provide other accommodations that allow them to continue working or work remotely if possible. The document provides a couple of references to think about risk mitigation. These include an OSHA publication where employers can think about how to break their workforce up into employees based on their risk level, low, medium, high, or very high. And then also the Centers for Disease Control provides some guidance for small businesses, which is applicable to any business in terms of how to prepare and do that risk assessment. I'm going to turn it over to Mike to talk a little bit about workspace organization.
Thank you. One of the questions we get on a regular basis is how do I start to organize my workspace to create the safest possible environment? So there's three key areas that we want to talk about here. First, social distancing as people and visitors arrive, leave, and interact. Two, in how they perform their work. And three, the cleaning process. So in terms of at work, when people are coming into the building, the first thing you should be working on is staggering start times. So employees are not entering the facility and operating floor all at the same time. You should consider scheduling shifts to avoid overlaps so that you can have one shift entirely leave the premises before the next shift comes in so that you don't have people coming in and out of doors at the same time. This could also include things like changing up your shifts from typical shift operations. Other things you should be working on is staggering break and lunch periods to minimize the number of staff in your break rooms. And also when you're doing that type of thing, closing off alternating seats in your break and lunch rooms and thinking about any other places in your facility that people may congregate at a regular basis or pass each other in the halls at a regular basis. Those are areas of high risk for your business, and those are things that you want to make sure that you have covered in this. One of the most recommended things is to look at where people tend to take their smoke breaks and making sure that those areas are clearly separated also. Another best practice that we're seeing is zoning your operation, and staff stay within the zones they're into to do their work. And if they need to share material from one zone to another, they bring the material to the edge of their zone, leave, and then the next person comes in and takes the product. And again, splitting employees between shifts and changing your shift structure is a valuable thing to look at right now. In terms of physical changes to your facility, you should be, to the extent possible, rearranging workstations on your floor to keep at least 6 feet of separation between employees. If you cannot maintain that separation, consider installing clear physical barriers or shields between operators. Also, if you can't maintain that separation, we recommend, and the CDC recommends, that employees wear PPE, such as cloth face coverings at that point. And then you should significantly limit any outside access or exposure from customers, visitors, vendors, contractors, and anybody else who's not critical to performing the work that needs to be done there. Finally, the other key aspect in organizing your workplace is make sure you have routine cleaning and disinfecting all frequently touched surfaces in the workplace. Those include the things that you would normally expect to clean, like workstations, keyboards, doorknobs, those types of things, and other things you might not think of, like garbage cans, other parts of doors, those types of things that you might not think of. And to the extent possible, remove items that could be touched frequently, such as if you have doors that are just swinging doors and you can remove them for now, just remove them. So sometimes you can just eliminate that hazard there. Discourage workers from sharing anything, and have standard processes to clean and disinfect according to CDC guidelines before and after. And provide your team with the tools and materials to make sure that they can clean their work in process and throughout the day on a regular basis before and after uses in their factory. If you want to see any more details on some of these options and others, you can go to the CIRAS website, and there's the link right there that provides ideas for signage and different ways to think about how to minimize risks on your floor. The next question we hear frequently is, how do I monitor my workspace to ensure it stays safe? So the first thing that businesses can and should do is screen all employees and visitors to your facility on a daily basis. So ensure you have controlled entry points that are separate from the general employee areas. Set up a repeatable, simple screening process that everybody can understand and that you've communicated in advance what the process is. Again, make sure you've staggered your start times, especially when screening. That's a very significant point there. And you can consider implementing a plan to screen temperatures upon entry to your facility. That has some complexities associated with it and things that you should be aware of, especially when it comes to ADA requirements and those types of things. If you go down to the reference below there, CIRAS has a checklist for employee screening that gives you some of the details behind things to think about and considerations when doing temperature screening, along with selecting temperature screening products. But if you are going to screen for temperatures, you should be using an IR thermometer that is a no contact thermometer. Second on this is make sure you have policies and communication in place to actively encourage employees with COVID-19 to stay home, whether or not they have a positive test, and have a clear plan in your business for when a positive case occurs. How will you communicate? What will be required of the employee and visitor to re-enter the workforce? And make sure they understand what the impact is on compensation and what the process they should go through as an employee. The Iowa Department of Public Health has a great, very simple decision process, which essentially says if somebody comes to your facility and has any symptoms related to COVID, they should not go in the facility. Now I'll pass it back to Kristen to talk about the next step.
Right, so even with minimizing contact, creating plans and policies, and preparing your workforce, employers still need to be prepared for if there is an outbreak or even a positive case in the workplace. So this final question is really to think about what will your response be and what kind of reporting you should do as a result of that. So the Iowa Department of Public Health has issued guidance to exclude employees reporting fever or respiratory symptoms, one or the other. They don't have to have both. They don't have to have all symptoms. But if they have either the respiratory or the fever, they should be excluded from the workplace. Again, this is with or without a positive test. It may be difficult for employees to get tested right now, depending on the criteria they meet for the state's testing, and depending on where they live, and then also depending on the employer. Of course, the employer should increase cleaning and disinfecting protocols following the CDC recommendations. Those are linked in this document. In many cases, you may not need to shut down your facility, but it is recommended to close off areas that were used for prolonged periods of time by the sick employee. You may want to consider excluding other high-risk employees when outbreaks are ongoing. So again, thinking about those individuals in your workforce who are at particular risk for complications from COVID-19. And you'll want to think about who that infected employee has been in contact with in terms of other coworkers or even rideshare partners or other parts of your business, such as customers. Prolonged contact is right now being defined by the CDC as being within 6 feet of someone with COVID-19 for 10 to 30 minutes or longer. So there isn't very precise guidelines on how long you need to be around someone. But if you think about anyone that person has really had regular contact with or been close to throughout the day should be notified. Those individuals are recommended to stay home and self-monitor their symptoms for 14 days after that exposure. There is a slight alternative recommendation. If your business is deemed critical, employees who have had exposure can remain working while they're asymptomatic, as long as they are adhering to strict social distancing and monitoring protocols such as wearing PPE, regularly testing their temperature, and going home if symptoms do develop. We have provided that specific guidance for critical workers. So these would be those employers who are identified as a critical infrastructure workforce and will not close even in the case of a state order. The Iowa Department of Public Health has an online reporting mechanism for employers who are experiencing absenteeism of 10% or more. We've provided the link directly to that. That's something that employers can bookmark and have available as needed. And right now, employers could talk with their occupational health provider if they have one and find out if there is a pathway for them to be able to put in place a testing protocol for symptomatic or asymptomatic employees and determine employee contacts for that testing. We have not had many businesses that have had strike teams available to do testing. There have been some of that have occurred in the meatpacking industry and then now in the long-term care industry. So we assume testing protocols will move to general business in the future, and as those are available, we'll provide that information here as well. Just over the weekend, CDC updated their guidance about employees returning to work. Right now, you have two options. One is if the employee has been fever-free for at least 72 hours without the use of medications to reduce fevers, and respiratory symptoms have improved, and it's been at least 10 days since their first symptoms. This had been 7 days and has been moved to 10 days. The second option would be if testing is available and that employee's fever is gone, respiratory symptoms have improved, and they receive 2 negative COVID-19 tests in a row that are at least 24 hours apart. So most likely employers will be looking at option 1 right now in the absence of a strong testing protocol available. We have a link to the most recent Iowa Department of Public Health guidance for managing outbreaks, as well as a document from CIRAS for responding to a COVID-19 exposure, and the latest CDC information on when employees who've been affected by COVID-19 can return back to work. I'm going to turn it over to Wendy to talk a little bit about the support that we have available right now to employers who have additional questions or would like someone to walk through this with them, troubleshoot some of the specific issues they have, or have other safe at work needs that hopefully we can assist with.
So thank you, Kristen. As Kristen mentioned, we started a COVID-19 business helpline, and this helpline is available Monday through Friday from 8:30 to 4, and the number is 563-588-3350. And we also have where you can go and send an email to sbhelpline@nicc.edu. The importance of this COVID-19 business helpline is that we have staff who have been trained to triage all of the phone calls. We've had well over 500 phone calls, and this is a partnership. We have counselors from the Greater Dubuque Development, from Small Business Development, from East Central Iowa Intergovernmental Agency, as well as staff from the Northeast Iowa Community College. We also have experts that are available to us to help answer some of our questions. So we've had well over 500 phone calls, and out of those phone calls, we receive multiple questions. And what we do is we take those questions and then we try to get answers. We have Greater Dubuque Development staff who have helped us research. Our team has helped research it, and we get that information, and then we reach back out to those businesses, and we also do training for all of the counselors to make sure they're aware of that. So we assist with helping individuals fill out funding applications from the state of Iowa or from the federal CARES Act. We also help with some of their business planning financials that are required for those, as well as just answering any questions that they may have that we can, as I stated earlier, research. And this is one of the questions that came up, is how do we continue to promote a safe work environment, or how do we reopen our business and assure that we're having a safe work environment? So this is one of the webinars that we're bringing to you. Further, what we have been able to do from the Small Business Helpline, we had 2 other webinars where we provided information out to businesses. We reached almost 200 businesses from those 2 webinars. And when we host those, it's based on questions from the helpline, and then we basically bring in experts to help answer those questions. So we're really asking you, if you have questions that you would like, if you could send those either through the email to sbhelpline@nicc.edu, or call and talk through that with our triage team. We will then research that and make sure that we find a platform, either from a live Zoom, a taped webinar, or through a newsletter, that we will be willing to send that information back out to you and to also multiple businesses. The webinars, we're trying to do them at least twice a month, as well as sending out a weekly newsletter update to make sure that we keep you informed from those local experts, and with research linking you to resources to assist you.
Great, thank you. One other piece of information we've provided is for employers to think about what kind of sample documents or policies you will want to create. we've put together a list of documents your business should consider creating and utilizing as you look at how you're going to respond to COVID-19 in the workplace. This certainly isn't an exhaustive list, but we wanted you to just have a sense of what kinds of things you might want to think about, such as formal communication to employees regarding screening processes, as Mike suggested, an employee questionnaire, memo to employees if you believe you are an essential business operation, travel policies, leave policies, communication regarding return to work that's consistent with CDC or Iowa Department of Public Health guidance, or flexible hours agreements. A good resource on samples of these documents or how to develop them can be found through SHRM, Human Resources, available. Many of their COVID-19 resources are available for free in addition to their membership right now. So we did provide a link to the Society of Human Resources for employers to review, or have your HR team review as well. Finally, since PPE is an important part of the safety process, as well as cleaning protocols, we have provided, as part of this tool, a current list of Dubuque area vendors that we have confirmed have the availability to procure hand sanitizer, face coverings, and then also provide CDC compliant cleaning services. We're sure this is probably not an exhaustive list. So if your business offers these products or services and would like to be included, you're welcome to contact us at Greater Dubuque Development, and we'll make sure you get added. And I know CIRAS has a list as well available on their COVID-19 resource page. Mike, do you want to talk about some of the vendor lists that you have available?
Yeah, so as you mentioned, one of the key things that we're trying to make sure is that companies have access to helping find some of these vendors that they just haven't had a chance to interact with in the past. So as we've learned about companies, we've been keeping lists of cleaning service organizations that work compliant to CDC guidelines, different companies that provide cloth face coverings, along with face shields and other products, as we're learning about sources of products, including hand sanitizer and just about anything else you could ask for. If you have trouble finding it and we don't have it up there, we will help you find it.
Yeah, so this is one of the great reasons we're happy to have CIRAS as a partner. So if you have difficulty procuring PPE from any of these resources or others, again, please contact that helpline and we will do our best to find that resource for you. We do not have a local vendor for thermometers, for example, but we have successfully found one or two sources that we are happy to share with you as well. So again, those are all valid inquiries to the helpline that we can assist with. Finally, we've provided sources for all of the guidance in this document. As I said in the beginning, we did not create this guidance or recommendations, but we've hopefully put it into a package that's a little easier for you to digest as a business or for your team to work through in implementing safety within your own workplace. Finally, we understand that counties in Iowa are under different proclamation orders right now, with some counties, not including Dubuque County, that had some reopening as of May 1st, and then others reopening on May 15th. So we will continue to provide updates at greaterdubuque.org/safe to this document as reopening guidance is available. And we do hope to have at least one webinar recorded before that time to answer questions about reopening as that guidance becomes available. Again, I wanted to share the NICC and Greater Dubuque COVID-19 Business Helpline is available to help you. That phone number is 563-588-3350, or email at schelpline@nicc.edu. Thank you for listening to this. Please reach out to us with any questions, comments, concerns, and we look forward to serving you. Thank you.